everyone, and welcome. I'm Noelle Diamond, here with my partner in health and in life, Stuart Diamond. We're so glad that you're joining us for this important conversation around male fertility, a topic that deserves much more attention than it gets.
As we close out April and mark National Infertility Awareness Week, we're highlighting the fact that male infertility accounts for nearly 50% of all infertility cases and less than 7% of men seek out care. It's still shrouded in stigma and misunderstanding. Today, with Noelle, we're diving into some of the biggest myths and sharing the truth men really need to know, as well as their partners.
Okay, so let's get started with a quick male fertility 101 and then jump into some myth busting questions.
I love that idea.
What is male fertility?
Male fertility is the man's ability to cause a pregnancy. It's primarily dependent on quality, quantity of sperm, morphology, motility, how the little tails are moving, and multiple other factors, including hormone issues.
So, what influences sperm health?
Many things influence sperm health. Age of the patient, hormonal variations such as testosterone, FSH, and LH. There are lifestyle issues such as healthy living, exercise, stress reduction, smoking, environmental issues like what do they do for a living? Do they work in a tire factory? Do they work outside? Heat exposure, other health conditions, diabetes, high blood pressure. It's a complex topic with many variables, but we can help all those variables to birth a child.
So, it all really comes down to the quality of the sperm.
That's correct, Noelle.
Okay. And then do men have a biological clock like women do?
They do. I mean, as men get older, above 40, they continue to have more health issues, testosterone, hormone issues, a lot of topics we just covered, weight issues, the medical conditions get worse. So, yes, they can have children as they get older, unlike women who are menopausal who cannot, but those issues are more difficult and challenging. Of course, mutational defects in the sperm, things of this nature.
Okay. Does erectile dysfunction mean low sperm count?
No, patients with erectile dysfunction may have difficulty ejaculating, so that could be the cause of their sexual dysfunction as well as their underlying difficulty having pregnancy, but themselves does not affect the production and quality of their sperm.
As someone that is online frequently, I feel like everyone on this platform feels the same way. We are bombarded with a lot of supplements and herbal remedies. Do any of these work?
So, on their own, without professional guidance, I would say no, but certainly in my fertility practice, not only am I doing traditional medications to help with sperm production, but there are some herbal medications and vitamins that I do recommend, but obviously they need to be orchestrated by an infertility specialist.
Okay. And everyone wants to know boxers versus briefs.
All right, let's settle this once and for all. Boxers, of course, because the testicles lie outside the body to allow the testicles to be cooled in the cool air. That improves the quality of sperm production. When they're warm or heated, the quality of the sperm production goes down. So, yes, boxers.
Okay. And so does testosterone play a role in sperm health?
So, unfortunately, a lot of people are doing exogenous testosterone without medical supervision or under medical supervision, but the doctors themselves do not know that exogenous testosterone can affect testicular and sperm production. So, I see a lot of patients who are taking testosterone, and that is the direct reason why they're having sexual dysfunction, or I should say, more particularly, fertility issues.
All right. Well, thank you for all this. Right now, we're going to open it up to some Q&A from the audience. Please feel free to submit your questions, and we'll do our best to answer them. Question looks like, does frequent ejaculation lower sperm quality?
Jay, that's a great question. And I would tell you, no, you want to be sexually active because obviously it continues to improve the growth and production of quality sperm. And that's what we're looking for. So, frequent ejaculations can improve production.
How about diet and exercise? Does
That's a
that play a role?
great question, Noelle. Of course, the more we are dieting and exercises, that improves and lowers our oxidative state, and that can really improve production of sperm, the sperm quality. So I often encourage our patients to get out there, eat better, eat a healthier lifestyle, and exercise.
We have another good one. How does stress affect it?
Stress obviously is huge impact on our general health. It's going to have a poor impact on our quality of sperm. So stress reduction, which in the genre of fertility can be very stressful itself with two partners, sometimes wondering who's the cause of their fertility issues. I say work together, reduce the stress, and that will help not only produce a child, but in your life in general and health.
Great advice. Maybe easier said than done now.
I speak the truth.
Okay, let's wrap up with a few takeaways. Male fertility is real and an important factor in conception. Lifestyle changes can make a difference. Don't underestimate sleep, diet, and stress management. Supplements aren't a magic fix, and make sure you talk to your doctor. Don't wait. Early testing is key and can provide clarity and options.
For anyone navigating this journey, you're not alone. Resources like patients like me offer a supportive space to connect with and learn and take charge of reproductive health.
Thank you for joining us. Keep the conversation going because when we talk about male fertility, we move the needle on awareness, empathy, and action.